All right. Good afternoon, everyone. My name is Dr. Nina Anderson. I'm the Executive Director of TOVA Community Health, and we have a wonderful TOVA Talk series this afternoon because June 19th is World Sickle Cell Day, and it's also Juneteenth National Independence Day. The United Nations and other countries will be celebrating World Sickle Cell Day to raise awareness and support those suffering from sickle cell disease. And today, we are setting up a TOVA Talk series to reach primary care providers, hematologists, nurses, caregivers, and sickle cell warriors across the country. The title of our presentation today is Access to Sickle Cell Care Across the Globe. And I want to thank our sponsors for allowing us to have this great presentation. GBT, Family Medicine at Green Hill, the Sickle Cell Disease Association of America, and TOVA Community Health. I'm Dr. Anderson, or you can call me Dr. Nina. Again, I'm the Executive Director of TOVA Community Health. And our mission here at TOVA Community Health is to provide comprehensive, compassionate, holistic care to individuals with complex chronic conditions like sickle cell anemia. And yes, though we're located in Delaware, we are accepting new patients. Wow, Dr. Sue needs no introduction. We have known each other for over 20 years. We worked at the Marian Anderson Comprehensive Sickle Cell Center when he was just a peon, a little fellow, but now he's a big director of a sickle cell program in Chicago. He is a world-renowned hematologist, and I thank you so much for doing this presentation today. As you know, his resume and his CV is super long, so one of the things I challenged him with was to condense a brief bio down to one page, and he was able to do that. And one great thing about Dr. Sue, we both share, we're both violinists, classically trained, and we did play together many years ago, but I challenge you, I'm coming to Chicago and we're gonna do something to raise awareness for sickle cell. Interestingly, he is also an NIH-funded researcher, and he has done lots of research on acute chest in mice with sickle cell disease. So Dr. Sue is a professor at pediatric hematology at the University of Illinois in Chicago, and he has devoted his career to sickle cell disease. He earned his PhD in biophysics at the University of Rochester, followed by a pediatric residency at Yale and a fellowship at the Children's Hospital of Philadelphia. During his 25 years in leadership of some of the largest sickle cell programs in the country, he has co-authored Hope and Destiny, which 5 people today will receive a signed copy of Dr. Sue's book. And it also focuses on educating families on sickle cell. He provides training for community health workers and volunteers as the Chief Medical Officer at the Sickle Cell Disease Association of America since October 2020. In his spare time, he is a guest professor and a guest speaker at the University of Campinas in Brazil. And during the pandemic, he is teaching online courses on sickle cell and the implementation science for sub-Saharan Africa and Saudi Arabia. He has known me for over 20 years, as I stated, and he started at St. Christopher's Hospital, where we worked at the Marian Anderson Sickle Cell Center, where we met. So without further ado, I want to bring on Dr. Sue.
Thank you so much for the introduction, Dr. Nina, and thank you for the invitation to be here. Sorry I can't come in person, but this is still challenging for everybody to travel. What I wanted to do is just introduce a few ideas about why World Sickle Cell Day would mean something for people in Delaware or Chicago or whatever else. And this is a general background type of slide, I think. Yep. And so World Sickle Cell Day These are my disclosures. I do some research. I do some consulting. I'm just going to discuss publicly available information. I'm not trying to endorse commercial products. So the first thing about, I got this thing in the way. Okay, the first case of sickle cell disease actually has something to do with being world as the focus today. That the first person who was described in the Western medical literature with sickle cell was being described in Chicago, but he was actually from someplace else. And so this map shows that he was from this little West Indies island called Grenada, and he came to Chicago for dental school because this is one of the few places at that time that was training a Black person to be a dentist. He couldn't get in dental training at the places that he was, so he came to Chicago. And this blue circle shows pretty much where my office is on the map, and about where the first case, where the doctors who were writing the first case, the hospital where he was getting hospitalized, Walter Clement Noel was getting hospitalized, was just like 2 blocks away from my office. But he came all the way from Grenada to Chicago. And so he was kind of a global health type of student, a visiting student. And he got diagnosed with sickle cell after the puzzling pattern of having hospitalizations for pain that wasn't explainable with the other kinds of diagnoses that were there. It did not seem like rheumatoid arthritis, did not seem like anything was broken, did not seem like he had an infection. And then finally they did this new test, which is called looking under the microscope. And they saw these cells that were shaped kind of like the ones that are on my tie here. Let me see if I can show my tie. Can I still get it or not really? Oh, well. But the cells were elongated shape, kind of shaped like the crescent moon, or a farming tool called a sickle, or the banana shape. And that's what led to eventually the name sickle cell disease. And so that was over 110 years ago, 112 years ago now. But he came from Grenada. He actually graduated from dental school. And so it does also show that having sickle cell disease does not hold you back from professional career. And he went back to Grenada, and he was one of the first dentists in Grenada. I think he was like, there were maybe 2 on the whole island. And he practiced there successfully up into his 30s or so. And then he died early, unfortunately, but he did successfully go do that. The pattern for sickle cell genetics is that it is a worldwide condition, so that the darker colors here, the brown, the red, show where there's more sickle trait across the globe. And you can see that the countries with the darkest colors, the most numbers of babies with sickle cell disease and sickle trait are in Nigeria, shown here, Democratic Republic of Congo, India. And so Nigeria has the distinction of being the leading country in the world with sickle cell disease. About 150,000 babies with sickle cell disease born in Nigeria per year. So that's more than there are total people with sickle cell disease in the United States, total of all ages. There's more than that of just babies born per year in Nigeria. So it's a huge problem that involves many, many people. But my global health experiences with sickle cell started pretty much in the late 2000s, the first decade of the 2000s, with some meetings. One, I went to a meeting at a hematology center in Brazil. It's called University of Minas Gerais. And then later, just like within the year, hosted a Brazilian ministry study team for newborn screening in Philadelphia. So they came to Philadelphia, came to visit St. Christopher's, came to visit Children's Hospital of Philadelphia to find out how the United States is doing sickle cell screening so that they could basically learn from the best that we could do and also learn to not repeat our mistakes. I went on to keep connections with them, went to another hematology center that was at University of Campinas called the Hemo Centro. And there I got to spend about a month doing consultation and research on sickle cell disease, talking to the students there about clinical stuff, learning how they do things, also talking to them about sickle cell mice, so that they had some mouse models with sickle cell. University of Campinas is kind of in the middle of the country. People call Campinas the Cleveland of Brazil. It's a very high industrial type of town, but it has this university that is this lovely garden type of setting, and they have these giant rodents roaming around, the capybaras. There's the size of bigger than a wheelbarrow, smaller than a Volkswagen, and they're just walking around on campus. So you would compete for your space as you were going down the road. Kept on going with collaborating with Rio de Janeiro, and then also hosted a guest professor at Chicago who was from Brazil and from Campinas. And she gave some guest professor types of talks there, and then also had some students, and then finally went to another hemo conference in Rio de Janeiro. So here's some pictures. This was Dr. Silvia Brandelis coming to do the guest lecture. Get this out of here. Yeah, all right. And so you can see her a little bit better. So she was talking to our child life specialist, to some of the doctors, to some of the students, to a social worker, to more students, got to go out for a Chinese dinner with us, with faculty and so forth. And so Dr. Silvia Brandelis also ended up co-authoring a book with me, which is one of the Hope and Destiny books here, so that this version of it has 3 authors on it. It's me and Dr. Silvia Brandelis and one of her nurses, Carmen Rodriguez. And then we put in there, into this book, stories of teenagers with sickle cell and what kinds of things they faced as challenges, what kind of dreams they had, and sharing about that really brought out the idea that teenagers are teenagers, whether their name is like Jamal, whether their name is Carmen or Paulo, maybe the sports they play is a little bit different. So all the Brazilians were playing soccer, even the ones with sickle cell. They had not heard of American football very much, but there's stories of how they dealt with sickle cell, the frustrations and the problems, as well as the dreams and ways of overcoming things were strikingly similar. And so we put that into this book, Hope and Destiny Jr., short stories. Also ended up translating one of the books that we did have in English into Portuguese. And so here is Portuguese version of Hope and Destiny, Esperança e Destino, and with different diagrams also translated into Portuguese. So I can't pronounce all these things. For a little while, I learned some Portuguese, and I've lost it over the past 5 years or so. But this was also translated with the help of her staff. So this is a way to spread around some of the information, because as you can see on this global map, the amount of sickle cell in the United States pretty much like the amount of sickle cell in Brazil, and it's a big country. It's practically the same surface area as the US. So Brazil was a big, interesting experience. I also got to meet this gentleman, Elvis. So his name actually is Elvis. Elvis Silva Magalhães, who had a bone marrow transplant for sickle cell disease in Brasilia, in the capital of Brazil, in 2005. And here he was at a sickle cell conference 9 years later, looking great. And he wrote a book about how he was under the crescent moon for a large chunk of his life, but then now he was not under that crescent moon anymore. He was under a full moon. And so that's pretty much what the title of his book says. And he became an activist for sickle cell, was on like newspapers, radio shows, TV, social media, trying to increase awareness of sickle cell and say, this is what it was for me, but I am now able to have enough energy because of my transplant, which was, by the way, from his brother, to be able to really have a lot of activity. And so he, with the name Elvis, was a very striking person. And so I made sure I took a picture with him. I've kept in social media contact with them. This is a picture of what the Hemocentro looks like in Campinas with one of their publications where they were looking at what kinds of things happen with the mice. And this is Dr. Nicola Conran, who is one of the lead researchers there. And this is where I was hanging out for about a month as a guest professor. And this is the unfortunate thing about global health, is that some of the things that happens is outside of your control. So this is a graph that shows the exchange rate between the Brazilian real, which is their currency, and the US dollar over the time period from 2003 to 2022. And what you can see is that the Brazilian real was strong against the dollar for this period, and then it became weak. And guess when? These were all my contacts with Brazil, was when Brazil had enough money to be able to work on things such as more sickle cell research and care and so forth. As the Brazilian economy and the strength of their currency declined, it's been sad. Many of the things that my colleagues there were able to do have been taken away. And so they don't have as much time or attention or resources to do things, including inviting international visitors, including sending visitors overseas. And so we're still doing things by social media, by Zoom, etc., but not nearly so much direct interchange. So that's one of the realities, unfortunately, of global health, is that you're controlled by external events. So back to the sickle cell genetics. Because things were dying down with Brazil, I got the chance to work with some other countries and really started to working with folks who are in Nigeria, or people who are Nigerians but living someplace else and maintaining connections, trying to help Nigeria. And I do this partly out of a sense of just curiosity, but a lot of it is out of social justice. And then because America has so many health disparities, but the disparities between the US and the rest of the world is just huge. And so the rest of the world talks about, you know, when we have a challenge and a problem, it's like, I don't have food for my entire family for years, and we could just plain starve to death. Or we have, you know, military coup, and it's not just like there was going to be something bad, but there's actually people getting shot or bombed or things like that. Whereas in the United States, we have problems, but they're what people call first world problems, like my car is not big enough, or we have political unrest, but it doesn't quite get as bad as it is elsewhere. So having the chance to apply some of the things that we have here and try to bring it to other countries has been kind of an interesting exercise and kind of a calling and a mission. So one of the things that we found is that a way, and I can't get this bar out of the way, to incorporate stakeholders' input into a project, such as a sickle cell project, uses this stuff called implementation science frameworks. And implementation science is a combination of things with organization, business, psychology, management, and they try to make things work out better by looking at feedback, looking at tweaking the system so it works, but also listening to your stakeholders, listening to the patients, listening to the families, listening to the nurses and the clerk at the front desk to try to figure out how to make your project fit what's there, try to make the capacities as good as possible, try to make the implementation go as well as possible, and evaluate it, and then keep on sustaining it, and then keep on going. And so having this kind of approach is very different from just planning a project in a round table, in a oak paneled room, and then just launch it with money, and then 5 years later come back and find out why it didn't work. Well, it didn't work because you didn't listen to people. But if you listen to people, then you could be making adjustments and trying to make it fit better. So got to do some study tours with Nigerians and with Nigerian expatriates, went to try to blend in. So they dressed me a little bit. So I wasn't wearing the same outfit that I have right now. Got to talk to ministers, got to talk to nurses, and got to talk to many people who are lab personnel and these interesting people called community health extension workers and traditional birth attendants who are more in these pictures here, different than the ministers that are up here. And we got to talk to all of them about how to put in newborn screening for sickle cell in Nigeria, where, as I said, the most number of babies born with sickle cell disease in the entire world. And the traditional birth attendants would be the ones catching these babies, and then they would be the ones who could talk about, hey, we would like to do a blood test, a heel stick test on your baby, and see if we can have detection of whether they have sickle cell or not. And then the community health extension workers are these interesting folks who are in the neighborhood, in the urban place, or in the village, in the rural place. And they have the role of letting people have awareness of what the latest project is, whether it's about childhood diarrhea or malaria testing or HIV awareness. They're also the same people who work on political awareness. So they also get out the vote for the governor or the mayor or something like that. So they're kind of interesting people who are like the big man or the big woman in the neighborhood because they get to do this kind of stuff. We tried to do training with them, and we gave them scenarios, and they quickly, spontaneously turned them into skits with props and roles. And here we're pretending that this couple here off on the right is the couple with a new baby with sickle cell disease, and they're talking to their parents. So these are supposed to be like one set of parents, and then there's mother-in-law, and they're listening to what this newborn's parents want to do with their baby and trying to get support for it, saying that, you know, they said at the health center, we should start the baby on penicillin, we should bring them in for checkups. And should we do this or should we do the traditional medicine? And so they would go through this skit, and here this couple is bringing their baby. And again, they made a prop. They wrapped something in a paper, and they said, we're going to pretend this is the baby. And so there's this traditional healer lifting up the pretend baby, kind of doing trying to get a traditional blessing for the baby, and then telling the couple, well, I, in my traditional Nigerian medicine way, I'm going to recommend that you do this herb and that broth, and pay me 3 chickens and 500 naira or something like that. And so the couple thanks them and then goes back to the family, and they weigh the cost of what was going to be done with the traditional versus what the health center said. And then the mother-in-law said, well, you know, the chickens and the amount of naira that the traditional healer, that's actually more than the penicillin would be. Let's go with the penicillin. So they solved the problem on economics in the household with this role playing. And it was very cool. So that was a way that they thought we could gain support of the traditional leaders, maybe not the traditional medicine person because he lost out on his customer, but fostering collaboration, creating awareness, and using the existing infrastructure to do things. To give an example for how the existing infrastructure could also be used, turns out that the newborn screening done for sickle cell would use these things called Guthrie cards, which is exactly what's done in the US. And the HIV screening process in Nigeria was already using Guthrie cards. And so they're already there, they're in the health centers. And the way they ship these to the lab is not with a special truck or something like that. They have these guys with, like, part of their job is that they're delivering the Coca-Cola or something like that from one place to another. But as they're going from place to place, they'll also take a package for auntie or some message for this business person who needs to get it to the next town. And so they'll also stash a little packet of Guthrie cards and bring it to the same place. And so you use this informal transport industry to get things done. And the scenarios also went on to have, okay, here's the public health nurse, the senior nurse and the junior nurse. Can you tell which one? And the junior nurse is trying to have to tell the senior nurse, we ran out of the Guthrie cards because we couldn't get the order in. And the senior nurse is disgusted and dismayed and says, I left you to take care of this, but how come you didn't? And the junior nurse is like trying to explain to the senior nurse. So they'd end up doing problem solving, trying to figure out how to not fire the junior nurse, but actually teach how to plan ahead and get things done. And so that was also another scenario. And they smilingly, these things were very well received, and the problem solving ended up doing team building too. And people started using catchphrases that they'd use during the role play to refer to each other for the rest of this training session. Like that younger nurse was called the Millennial Nurse because she was in the millennial generation. And the senior nurse said, oh, those millennials, all they know how to do is their cell phones. They also have visual aid type of things, where this is the way that they teach for maternal health, how to recognize when somebody, how to take care of a pregnant lady, that you have to check every so often, check blood pressure, get her good foods, let her get some rest. So she's sitting under a tree thinking about these different fruits. She's sleeping under a malaria net. I don't know if you can see that on the mattress here, and then a malaria net, kind of like a little tent. But this also shows on the right how you recognize that this pregnant woman is very pale. And it's by looking at her tongue, the color of her tongue, looking at the color of her palm, and her palm is very, very pale compared to a normal palm. And then they also look at the inner eye. And so this is all cues to in a non-word, there's no words printed on here, to remind the traditional birth attendant what kinds of things to look for, what might need to have this pregnant lady go for higher medical services. Some of this, basically, we could take this learnings from Nigeria and apply it in the US, use role playing, use scenarios, try to train the trainer and try to use visual aids to bring out concepts. And so in the United States, the newborn screening continues to roll on. We do screen all babies for sickle cell disease. And that's been going on for probably about 25, 30 years now. So everybody in the audience here who's under the age of 25 probably has been screened for sickle cell disease and should know whether you have sickle cell disease or sickle trait or no sickle, whether your name is Adolfo, Cesar, Justin, Gabriel, or whatever. And then I want to conclude this session here with just a tribute to Dr. Kwaku Ohene-Frimpong, who is on the one hand from Philadelphia, Children's Hospital of Philadelphia, faculty, physician, researcher, but he was also from Ghana. And so he was my faculty mentor at Children's Hospital of Philadelphia. He passed away just last month after a full career at CHOP, as well as a very full career trying to bring on sickle cell screening, newborn screening for the whole country of Ghana, working really hard as president of the Sickle Cell Foundation of Ghana. He inspired me to be an advocate as well as a doctor, and to try to work with community and try to always build toward unity. And so in summary, overall for sickle cell, there's hope on the horizon, many different ways. And we're trying to use the community health models and the global health types of approaches to bring on greater awareness that there's new medicines, there's new cures and new approaches to health disparities with all kinds of different progress in sickle cell, which we are celebrating on this Global Sickle Cell Day. So thank you very much. Oops, and I will stop sharing. All right.
Thank
Thank you very
you,
much.
Dr. Sue, for a great presentation. And it's so nice to see that the work that we did at St. Christopher's, that you have been able to carry it on and still have relationships with the providers in India. So thank you so much. Again, I want to thank my sponsors, GBT. I want to thank Family Medicine at Green Hills, SCADA, and TOVA for this talk today. But before we end, Dr. Sue, we do have some questions that we would like to ask you, but we do have a poll question. So if you can bring up those questions, and for everyone who is on the presentation, we will ask you to respond to the questions that we have. And then Dr. Sue, you can go ahead on and explain those results. So can you bring up the questions, please? The poll questions. Jean? Is he gonna get them? Okay. Jean, the questions, the poll questions. All right, so we're having some difficulties with that, but we do have the questions that we're going to ask you, Dr. Sue, and then we have questions from the audience. So, Dr. Sue, what country has the largest sickle cell population? Is it Brazil? Is it India? Is it Nigeria?
That would be Nigeria. So Nigeria has something like 150,000 babies born per year with sickle cell disease. It's only an estimate because they don't have newborn screening implemented everywhere, but 150,000 babies with sickle cell born per year is more than the entire number of sickle cell individuals in the United States. And the unfortunate thing is that probably half or more of those babies will die in the first few years of life.
Okay. And I have a question that's come in. If anyone has a question, please put it in the chat now. Thank you very much. So this is one question that came in. It says, do you have a map on the rate of sickle cell and sickle cell trait, which would control for the population? So we're guessing that the African countries would have higher rates than India of sickle cell. Can you explain that?
Yeah. Oops, I've lost control of my screen here.
Kiana, he was supposed to
Can you still see me okay? Yeah.
Yes.
All right. I can't show this. Okay. So the general idea is that sickle trait protects people against the very serious condition called malaria. And malaria is carried by, I got a visual aid here, this kind of guy here. Can you see that? So this is from my medical bookstore, but so this is a gigantic mosquito. But mosquitoes like this carry malaria, and when they suck somebody's blood, they actually spit a little bit back into you. Very unpleasant habit. And when they do that, they can transmit malaria, and malaria is hugely a problem throughout much of the tropical areas of the world, and people die of malaria all the time, especially children. So if you have anything that can strengthen you against malaria, that's good. And people with sickle trait survive malaria better. And so the places in the world, all across the tropical parts of the world, pretty much, are rich in traits that help them to fight off malaria. And so sickle trait is kind of a super feature in a place with malaria. So people with sickle trait would then survive to have children, and then they can pass on the sickle trait. The unfortunate thing is that sickle cell disease would be if you have two parents with sickle trait, they get together and they make a baby who has both their genes for sickle. That baby does not do very well with malaria, nor other kinds of conditions. And so having sickle cell disease does not help you against malaria.
Thank you so much. And I guess the last question that I have is, how many people around the world carry the sickle cell trait?
Wow, we don't really know. Estimates are a couple 100 million probably.
Wow.
Large numbers of people.
Wow, that's amazing. That's amazing. So thank you so much, Dr. Sue, for a wonderful presentation. And we thank you for your service to the sickle cell community and all of you've done across the world. This has been a great talk today, and we were going to share that for those who were not able to get on the Zoom meeting today. Dr. Sue, how can they reach you if they have any questions?
Email would be good.
Okay.
So I can put that in the chat here. This is my work email, lusu@uic.edu. And then I also, because I'm Chief Medical Officer for Sickle Cell Disease Association of America, if there's stuff that can get sent to SCDAA or through One SCD Voice. One SCD Voice is a kind of a social media platform where it has multiple different features, and some of them is also the ability to send in questions and comments.
Thank you so much. Again, I want to thank you all for joining today. I'm Dr. Nina Anderson, Executive Director and founder of TOVA Community Health. If you'd like to learn more about TOVA Community Health, you can go to our website at www.tovacommunityhealth.org. You can also reach us by calling 302-429-5870, extension 120. We are accepting new patients, and we are located in Delaware. Thank you, Dr. Sue. We'll be in touch, and I have a violin concert coming, so get that violin out.
All right. If we say that for Global Sickle Cell Disease Day, it would be to wear red like you are doing, and I have just a little bit of red with my tie here, just a little bit, and shine a light to represent raising awareness. So here's my light. And take a selfie, post it on social media.
Yes. Thank you all for joining today. We're signing out. Take care.